provocative therapy is the art of using humor and reverse psychology in brief psychotherapy. I was never one for making people commit to long-term psychotherapy commitments, which I sometimes have had to do, but mainly I'm interested in getting ME, maximum effect for minimal effort, a minimum amount of times for the maximum effect, and that's what provocative therapy delivers. Sessions tend to be short, energizing, funny, enjoyable, and provoking people to make the internal changes they need. The name provocative therapy sometimes scares people because they think, what does provoke mean? So, and in normal use of the language, provoke means to incite anger. It also can mean to be sexually provocative, which is a bad use of the term as well. Not the meaning. It's not the correct meaning of provocative in terms of provocative therapy is not sexually provocative, and it's not to provoke or incite anger. It comes from the Latin provocare, which means to call forth, which is a perfect description of it, except that's not what people understand by provocative therapy. But it's been named provocative therapy, and the aim is to provoke, to call forth the solution which we believe is inside the patient in the great majority of cases. First of all, I sit down with the patient and I say to the patient, do I have your permission in the next hour to say things to you that in another context would be seen to be provocative, absurd, ridiculous, cheeky, etc. So they basically have to give me carte blanche to say whatever I want. Now that, to me, is important. If I seek psychotherapy from somebody, I want to feel that I'm talking to them as I would talk to any friend and not feel inhibited by language or certain terms or anything like that. So we get that out of the way. Also, I am going to say things that cannot be taken at face value. I might tell an alcoholic to drink more, or a smoker that he's hopelessly addicted and he can never quit, or a heroin addict that he must take the heroin because he's a rock star and all rock stars take heroin. And so there comes the reverse psychology, but it's always done with a twinkle in the eye and a fiction in the heart. So the patient feels from me that I really want him to implement his own solution, but I will never say it. I will tell people to do ridiculous things and see funny and paradoxical sides to their problems. That's how it works. It is not suitable for patients who need a very long-term relationship in order to feel safe with the therapist. So that therefore, you take a condition like personality disorders. Now those people often find it very difficult to trust somebody else. So a long time needs to be devoted to developing the trust and close relationship of the therapist and the patient. So it is more for the walking wounded. It's not for every single situation in life, but it's not only for psychological problems, it's for people who want something different in their lives. And that is why after I get permission to say crazy and ridiculous things, I then say to the patient, what do you want? Not what's the problem, not even what brings you here, but tell me what you want. If they can say that with certainty, I can often get them what they want. Sometimes they don't know what they want, and that's a different issue.